Hi, everyone. My name is Lisa Wu, and I am a customer of Ritual, an investor of Ritual, and a mom to a 4.5-month-old. And I am very excited to be here today to talk about postpartum exercise and strength. And so we are joined here today with Emily Breeze, who is a fitness influencer, a personal trainer, a D1 athlete, and a CrossFit athlete, as well as Alicia Willoughby, who's actually my physical therapist. She is a women's health and orthopedic physical therapist. And so to begin with, I think what would be helpful is if each of you could just introducing yourself, your names, your companies, your areas of expertise, and also just share the number and ages of your kids.
Perfect. Well, hi, everybody. I am Emily Breeze Watson. I currently live in Charlotte, North Carolina. And as you said, I am a fitness influencer, and that name is always kind of like something that is interesting to me, right? Because I find that there's a lot of people out there that are doing fitness on social media, and I am a personal trainer. I've run boot camps with Hall of Fame NFL athletes. I competed in the CrossFit Games, Division I athlete, and truly just an athlete my entire life. So I love sports, fitness, health, all of it. So I really enjoy what I get to do, and I feel that I am almost playing for a living, right? So I'm having fun every single day. I have 3 kids. I have a 4-year-old boy, a 2-year-old girl, and then a 1-year-old girl. So life is pretty crazy and busy, and I love to incorporate health and fitness with them too. So it's always fun.
Great, Alicia.
Yeah, I'm Alicia Willoughby, and like Lisa said, I'm a women's health and orthopedic physical therapist, and I specialize in prenatal and postpartum, and women's health means that I specialize in pelvic floor and abdominal conditions. I have my own solo physical therapy practice here in the Bay Area, both in Marin County and in San Francisco, and I have 2 kids. I have a 10-year-old daughter and an 8-year-old son.
So to get started, as a new mom, I and many of my mom friends find just the guidelines around postpartum fitness to be super vague. So one question that comes up pretty immediately after birth is, when can I get back into exercise? And the number that lots of people share is 6 weeks. I would love to hear just both of your perspectives of when is the right time to get back into movement.
Sure, I'll start because I'm probably seeing the mamas before Emily is seeing them. So the first thing that I will say is that I've never met a woman who is ready to return to pre-baby exercise at 6 weeks. Nobody is ready to run yet. Nobody's ready to jump yet. Nobody's ready to lift weights yet.
And why?
6 weeks is just an arbitrary number that somebody picked. It really just depends on her body, the type of birth that she had. So when a woman's ready is when she can show me that she can engage her muscles in the correct fashion and functionally as well. And that really, really will be case by case basis.
And is there, well, I guess, Emily, do you have a view on this as well? Because you've had 3 kids. It's just, when did you kind of start getting into movement? And is there anything that is okay to do before 6 weeks, right? That may not be CrossFit and to hit.
Right. I mean, I think she really put a great message out there, is that we are all different, and pregnancy is not a, one size fits all. And I think it's super important to listen to our bodies, right? And have this communication and dialogue with doctors and therapists that are educated and trained in these areas. I personally am neither a doctor or a therapist that's certified in that, but my own personal at around 4 to 6 weeks, I would start to do, some slow jogging, faster walking, and some body weight movements. But again, I think it, like she was saying, is based on your prior exercise and abilities and just how you're healing. So I think it really does vary from person to person. And I really loved the knowledge that she gave us, because I'm very close with my OBGYN, and they really don't give you a lot of information, after you've had a kid. And I think that kind of stuff is very valuable.
They maybe even screen for diastasis. Maybe they don't. Like that's just not part of their training at all. That's why a woman needs, more care.
Maybe what would be helpful is to just talk a bit more about physical therapy, because I know for me it was a very similar to my journey. That I got the clearance at 6 weeks, and I actually have a pelvic floor dysfunction that I didn't even realize until I saw Alicia, and it just fortunately just someone recommended her to just check it out, and I'm so glad I did before I got into running. But Alicia, what does a woman's health physical therapist actually do, and what can a woman expect on her first appointment?
Yeah, great question. Because we always think about physical therapy for athletes, for orthopedic injuries, for stroke patients, things like that. But as we know, after we've had babies, having a baby is a full body experience. So a women's health physical therapist is a physical therapist who has gone through extra training for internal pelvic floor work specifically. And then we also get extra training on abdominal conditions, such as diastasis and scar work postpartum. So that means that you usually are going to get an internal pelvic floor exam when you're seeing a women's health physical therapist. So not everyone's created equal, but I can tell you when a woman comes into me for a postpartum evaluation, she's going to get a full posture assessment, some biomechanics. So I want to watch her move her body to, like, if I have a runner, I'm going to ask her to do single leg squats. If I see that single leg squat like really wobbly, I'm going to say, hey, like your muscles aren't reflexively turning on yet. I don't think you're ready to run. Let's work on that. Then she's going to get a full abdominal assessment, which will look at abdominal separations, both the size, the structure, but also the function. Like, how does the abdominal muscles work? I've had small diastasis that work beautifully. I've had small diastasis that can't turn their muscles on at all. And then same thing, I've had larger diastasis that can turn on their muscles beautifully. And then if indicated is an internal pelvic floor check where you get a screening of there's 3 layers of the pelvic floor. So all 3 layers are going to be strength tested and endurance tested. I also check to see how a woman can engage her pelvic floor and her abdominals at the same time. Because if you're going to do any exercise from me or from Emily or from any other program, you need to turn on your pelvic floor, your muscles, and your abdominals at the same time. And the only way you know that is if you have someone feeling both muscles at the same time. So this is one of my favorite parts, because a woman might have really strong abdominals, but her pelvic floor isn't doing anything. Or her pelvic floor is doing all of it and her abs aren't doing anything. Or she turns on her pelvic floor beautifully and then I cue her abs on and her pelvic floor turns off.
And maybe quickly, you could help just define what the pelvic floor is. What surprised me was that I learned so much about the pelvic floor after I had a baby, and it's just instrumental to everything. Sarah, just what is the pelvic floor?
Yeah, I know. I wish I had my model with me, but I'm not in my office right now. So the pelvic floor consists of 14 muscles at the bottom of our pelvis. So it are the muscles that are responsible for both squeezing all of our openings and keeping our bodily fluids inside and then letting them go when it's appropriate, which women are most commonly aware of because of the term Kegels. But then the deeper layer of the pelvic floor is which holds up all of our organs and also attaches to all of our pelvic bones. So attaches to our hips, our pelvis, our sacrum, and our tailbone. So it's a really big stabilizer of the pelvis as well.
Emily, as a public figure, you have very courageously just shared your pregnancy and postpartum journey with everyone. And what tips would you have with just mothers about just who are nervous about getting back into shape or getting back into movement?
Right. I find that a lot of women, like you earlier stated, it's like we want to get back or bounce back as quickly as possible. And I think just giving ourselves grace and taking things slow needs to be the message that is applied to everybody and everywhere that we go. And just taking it day by day. You know, some days you're going to feel really great and then other days maybe not as much. And really tuning into that and focusing on what is your body telling you, because our bodies really speak to us every single day, pregnant or not. And it's if we will listen and take that advice and go with it. So I would just say starting with really small goals and taking things slow and knowing that things do come back. They might be different. They might even be better, but just really having that grace period and loving on yourself, because it's such a vulnerable time.
And do you, what would you say is like a realistic time frame for women to have, right? Because there's so much societal pressure as well, right? Which I'm sure that as a public figure you feel, and just curious what you think would be a realistic time frame and how that's changed with just having additional kids.
Right. I love when people always want to know, like, what is a time frame? And for me, with my first, I had just competed in the CrossFit Games, so I bounced back or felt like I was my normal self within like 3 months. But then my second child, it was more like 6 months. And then now recently with my third, I would say 9 months or longer, and it's just unique and interesting to watch that and just know that, it's different every single pregnancy. And just like I was going to be different than you and Alicia and anybody else, right? We all are just uniquely ourselves, and just being okay with that.
And what goals do each of you think should be top of mind when getting back into it? Like, what do you tell your clients? And it's likely different. I would love to hear that.
Yeah. So I just say, finding like strength, right? And that strength can be anything. It doesn't mean you have to go lift, a bunch of pounds or run a marathon. It's just kind of personal to everybody, right? And just finding whatever that goal is and just finding ways to attain it. So I just love like that self-love and finding that self-strength. Like it's just getting that 30-minute sweat every single day and feeling good about it. And then being able to spend time with my family. So I just think giving yourself that time and that self-care and self-love is a good thing.
And Alicia, would
Absolutely.
hear your clinical perspective on it as well.
Yeah, I mean, I think the goals, like just like Emily said, it's going to vary on the woman in front of me. Some woman's goal might be just to be able to walk an hour, where another woman's goal might be to compete in the CrossFit Games. My goal is for everyone to get back to doing exactly what they want to do. It just, that timeline is going to look different for everybody depending on their body and their birth and my findings in that evaluation. I think getting back to what you want to do, I love what Emily said about your body can feel better, because I feel stronger now than I did pre-babies, and I used to run marathons pre-babies, but I never worried about my core before kids because I didn't need to. And I'm stronger now than I was before I had my two children. And having my babies taught me how to take care of my body and how important it was to take care of my body, besides just running miles and being honestly really, really hard on my body and not accepting it for the amazing things that it does do for me. So I love telling my moms that your body will never be the same again. Like that body has never had a baby, but it can feel better than it did. And it should. Like our goals shouldn't be, yeah, I want to feel okay. No, you should feel fully capable and strong and able to do the things you want to do. I see women all the time that set their goals really low because unfortunately as a society, we have given mothers the message that, well, you had a baby, so what do you expect? No, we should expect better. Like there is better goals if you get the right care. The other thing I wanted to touch on is that what I hear the common theme of women saying to me, regardless of what their goals are, the common theme really boils down to, I want to reclaim my body as my own again. I want to feel like this body that grew a baby and birthed a baby and fed a baby and babies, like I want it to be mine again. And so what I usually tell them with exercise is, and what I found in my own body was a little bit of exercise on a consistent basis makes huge changes. You don't need an hour a day, but if you can give yourself, I mean, when I was doing my postpartum rehab after my second baby, like 15 minutes a day changed everything for me. And this was coming from running hours, so it not only do those little bits of exercise give you the strength and like the aesthetic changes that we all want, but those 15 minutes or more or less also help us reconnect with our own physical bodies. And that's what, as women, like we really want at the end of the day, is to feel like this body that is a mother and, has a partner, and like that this body is actually ours too. So it really just depends on what that woman wants to do.
You are speaking my love language. I try to preach that a lot to people, that consistency is everything. And like you said, just consistently moving, finding whatever it is that is your movement daily is so important. And I love that you said that. And it's true. I feel like when we have our time, we really do start to feel like ourselves, just that little bit of time each day.
Yep. I used to go out into the garage when my babies were little and do my 15 minutes a day, like on the mat. And I'll tell my moms that I know it's hard and I know like they're going to crawl over you and be underneath you and everything. But there's also this magic in them watching us
Yes.
exercise. And what my kids, I feel like, have learned is that when I say like, mommy's almost done, give me 5 more minutes, they know mommy's almost done because they've seen me finish up.
Right.
So they now respect that time. I mean, mine are, it's harder if you have like a 1-year-old, but like my kids now respect that mommy is going to go do her exercises and she will be done and then she will attend to you. But it's a gift to show them that we take care of ourselves, because how many women do you and I both see that are sitting in front of us and never got that model of care of their mother or the women around them taking care of themselves? And then we think it's selfish to take care of ourselves.
Yes. And I do think that society, like you said earlier, sometimes speaks on that is selfish, that we need to be just full on mom. But I think to be the best mom and to be the best self is to take care of ourselves and give to ourselves so that we can give to everybody else.
Yeah. Yeah.
Are there, on this topic, are there any other tips that either of you can give about just how to stay motivated, especially when we're juggling so many things as moms?
It's so hard. I teach a 4-week postpartum rehab class, and the tips I give them is an actual physical calendar to mark things off, like a sticker chart, like make your own sticker chart, because the days blend together and, we don't know what day it is. And before we know it, we're like, oh my God, I haven't worked out in 4 days or longer. So an actual like physical chart, I think, is really helpful. And then I'm all about just incentives, like giving yourself those actual incentives. If I do this many times this week, I get a latte at the end of the week, or, like those actual incentives to make us do it. Those plans, those incentives are really, really help as well. Then your body likes it. Like your body, really craves that movement and that strength. But I'm sure Emily has some really great ideas too.
I love what you said. I mean, I agree with you. I think creating that habit is important, right? And so that starts with that consistency, being consistency on, 10 minutes a day, 15 minutes a day, whatever it is, and kind of build with it, right? And then, you have that baseline. And like you said, your body wants to do it. It craves to do it. But I give my clients and friends and anybody who wants to work out is just like, get a time frame during the day, whether you're a morning, afternoon, or evening workout person, and just stick to it, just like you would a job or a kid's activity or anything that you have going on in your life, cooking dinner. Like, just make it a habit and a priority.
Mm-hmm. The other thing that I'll add is that what I tell my mom, specifically when they're doing like more of a rehab program, is to let their partners know their goals. One thing that I learned when my kids were little is that nobody's going to give me that time. Nobody's going to walk in the door and be like, hey, why don't you go take a half hour to yourself? Like, nobody's going to do that, even the most well-intentioned partner. So when we let our partners know, like, hey, I just committed to 4 to 6 weeks of this program or getting back in shape or whatever, I'm going to need like 10 to 15 minutes a day. Then like you loop them in, they want to help take care of us, but they don't know what's going on in our heads. And it really helps them also be able to show up for us and us not feel like we're taking something away from the family. So I like to tell people, like, let your partners know I set this goal for myself and I'm going to need your support as well.
Great. Yeah, I love the message about the self-care, right? Because I feel like when I can take that 20, 30 minutes for myself, I can really show up again for everyone else. And so just prioritizing ourselves and making the time. I'd love to talk a bit more about specific exercises women can get into. And Emily, I know that you've been very public on just your cesarean journey, right? And so what are some recommended exercises for women who are post-cesarean?
I want to hear a lot from Alicia because she is, so educated on this. We are just not aware of the next steps after having a baby. And for me personally, just having such a strong athletic foundation, I do listen to my body and I take care of it that way because it's such a gift to me. It's always been a gift and I really value it. So I take care of it and I think highly of it. So I think I just really take things slow and I pay attention to like, this feels good, this doesn't, and I just slowly ease into it. But I think the majority of people out there might not be as in tune, and I think that we as a society and as women, we need more education on this, and I think she's probably going to be a great expert at just, giving and building that first foundation.
Yeah.
Yeah, I think so. Whenever anyone asks me like what are specific exercises, I could never give you specific exercises because everyone is different. And I'm really not a one size fits all kind of cookbook type of PT that's like, you need to start with X, Y, and Z. So I'll kind of come back to what I said before, is that everyone needs to be able to know how to voluntarily engage their muscle, and with the right breath coordination. Over 50% of women are breathing incorrectly with their core activation. So nothing in my book, nothing can happen until that happens. You can do a million burpees, but those burpees are never going to help you if you can't, on my table, lie down and just make these muscles, correctly engage. So
can I interrupt you for 1 second? Like, but what if I have something going on? How does one know? Is there something that is going to speak to our body and let us know, or we need to see someone specific?
Right. You mean, so how would you know you have like a impairment or a dysfunction?
Yes.
Yeah.
For all the women out there.
Right. And that's what's so common, is that there's two groups. There's the women who have something that shows up right away, and they're usually the ones either coming to see someone like me or ignoring it and thinking that it's normal, like leaking urine, which I could talk an hour about.
Right.
That's the tricky part, which is why, I'm a huge advocate that everyone should have at least one assessment with a women's health physical therapist. A lot of these women have no problems until they're postmenopausal, and then they find out that they have a prolapse. And I just wonder how many of those women actually had some minor prolapse and pelvic floor weakness like 30 years ago, but no one ever checked them. So
I was in the latter group, which is that I actually had no symptoms, and it wasn't until I showed up, and that's when I learned that I had something as well. So
what brought you to see her though? Like, what was the initial like, oh, I need to see her?
I had taken a class before, and the instructor said she was very adamant about it, that everyone go see a woman's physical therapist afterwards, because people deal with things earlier that could have been addressed way earlier, and just not expect this incontinence or any sort of things that you hear about as normal. It's not normal, and it can be bad. And so it's kind of the gift I just did for myself, which is like, okay, let me just go see. I think hearing, when you don't hear something like a dysfunction and you hear about it, it can be better. But now I really feel like I have the tools to start rehabbing back. So it was really word of mouth. And I guess that's something really interesting, is that both you and I and Emily just didn't really know much about physical therapists, right? Alicia, why is it the case that that's just not vocabulary among women? It's starting to, right?
It's starting to. It's getting better. I think it's twofold. One, I think our profession could be doing a lot better of getting the word out there. I think as clinicians, and I experience this, you're head down in clinical work all day with patients, and you have paperwork and documentation. And so it's really hard to also then have the educational piece, which is I'm really passionate about. But I think as clinicians, we don't have a lot of time to do the outreach and the marketing, really. And then I think the other piece of it is societal. It's the medical system telling women that, oh, like, you're fine, you leak urine. Like, I can't tell you how many of my clients, like, oh, my doctor told me it's normal. The women who come into me, like, I've just been waiting for this to go away, but it's been 3 years and it hasn't. So I think it's twofold. From the medical community, our peers, are, like the prior generations, and then the physical therapy, like our profession has not been as vocal as it could be, because we are just drowning in clinical work, which is why I don't see clients 5 days a week, because I need 1 day to do all of my documentation running a business. And then I also want to, do all my outreach as well. I wanted to say one piece though to the, how do we know that something's going on with us? Because I was 5 years postpartum at my first pelvic floor course. So I did, I was doing orthopedics, and then I was doing orthopedics for prenatal and postpartum women, but I was doing everything but internal work. And then when I finally started my own business, I'm like, okay, I'm going to go do internal work. So I was 5 years postpartum at my first pelvic floor internal training, and found out that I have a prolapse. I have no symptoms. I know my body. I was an athlete prior, no symptoms at all. And on the day one, when we learned how to assess a prolapse, my partner was like, oh, so you have a prolapse. And I was like, what? But, I pushed out 2 big babies. My second one, I pushed out super hard because I just wanted him out. So who knows why? Maybe it's just my body and my genetics, but I have no symptoms. But I'm so glad that I know that I have that. because I know how to take care of it for the rest of my life, so that hopefully, you know, I cannot be a woman who gets into her 60s and 70s and then starts having prolapse problems, right, and symptoms. So I mean, even me, like I didn't even know.
Right.
One of the things I'd love to explore is also just around breastfeeding and fitness. Is that I used to run a lot, and the idea of running now while breastfeeding just sounds not enjoyable for me. But does breastfeeding affect fitness, and what do you recommend in terms of exercises for women who are breastfeeding? Does it change?
You know, for me, I was just super cautious with, you know, making sure that I was eating, you know, proper, good, well-balanced meals, and then hydrating a lot, you know, and I would just do both of those kind of at an extreme, or, you know, just make sure that I was aware of where I was at. And I never noticed a difference in my milk supply, but I think it goes back to a lot of us want one answer. Do you know what I mean? We want like, when can we work out again? Like just one specific answer. And I just don't think there is one, even with this. You know, I think all of our milk supply for every single woman out there is going to be different. And you just kind of have to navigate and explore and work towards, you know, whatever goal it is that you have.
I was a woman that when I tried to lose weight with my first, my milk supply went down. So it's just a time where our physical system, our musculoskeletal system is a little bit more unstable in its joint structure. So we need the muscles more than ever. Excuse me. So, but symptom wise, like Emily said, that will vary. Some of that goes back to how we are genetically. The women that are more hyper flexible, that are a little bit more loosey goosey in their joints, you know, systemically more slippery in their joints as well.
Got it. And I'm curious, are there exercises that each of you guys did both before having kids, and that have changed now that you've had kids? You know, for instance, I used to run a lot, and now I find myself doing a lot of Pilates, whereas before I thought Pilates was just, I needed that sweat, right? And I think that just changed with just understanding more about the pelvic floor. Just curious for you guys, just your, what exercises you did for your birth, and maybe they're the same. Share that.
I was a runner before my kids, and I did get back to running in between my two kids. And then I tried to get back to running after my second, and actually found out I have a hip genetic issue. So the doctor was like, you should stop running. So I don't run anymore. Honestly, I don't think my body would feel like I'm kind of like you, Lisa, and the feeling of like the just idea of that load coming through my pelvic floor might not be something that I choose. So I spin now for that like exertion, and I do way more strength training now than I ever did. Because before I was just a runner. I didn't have to worry about strength. I should have. I would have been a much better runner. But I do a lot more strength work now than I did pre. And then I also kind of back to that short interval kind of stuff. Like I'll do a 15-20 minute strength workout and feel great, where before, if I wasn't going to run for an hour, you know, what's the point?
And Emily, how about your fitness routine?
My routine is pretty much the same. You know, I think a lot of it has to do with that foundation. So strength training, CrossFit, HIIT, running, all of it. But I think having just like a really good, strong foundation and base. And then again, it is something that I love and enjoy, and it's my work as well. So I've pretty much stayed the same. Also, I get weekly chiropractic like adjustments, and like I call it a tune-up. So the guy that I see, he works with like our NFL team and all of those guys. So he's very good with athletes. And I just feel like it helps me just going every single week. And he just kind of goes through, you know, head to toe and adjusts, or, you know, helps me figure out if there's anything that's wrong or needs tweaked. And I think that is really helpful.
We have to think of everything that you do with little kids, like kids on our hip and walking out of, you know, with one kid under here, one kid under here. Like motherhood is crazy on our body. So it's really helpful to have somebody like looking at your structure and like helping keep it aligned, because motherhood is not about alignment.
Not at all.
Yeah, on that topic, I find that, you know, the shoulders forward because I'm breastfeeding and my hips are just misaligned. What are some things that you, I guess, what are some good postures for women to use to have better alignment?
With nursing, I think it's really important that we get as many, like just all the pillows, like all the pillows that you can possibly use. I'll say get baby latched, come back up, whatever pillows you need under your back. A boppy or a breast friend is usually not enough. We usually need more pillows underneath the breastfeeding pillow just so that we can come back upright. Neck wise, I'll tell them stare at your baby as much as you need to, but also kind of take some time to come forward. Look, say baby's on this breast, like look up, look the other way, come the other way, because a lot of mamas will get that neck stuff from just being off on one side for a long period of time looking at our precious little babies. And then a nice mirror, just a mirror check of a woman in standing. So I would tell a woman to stand up with a mirror side view. So the mirror is looking at you on the side. Close your eyes and just relax your body into your normal posture, and then pause and then take a look at yourself. And ideally you want to see that your pelvis and your rib cage are aligned in each other. But most women, especially when we have little babies, we're letting our backs come back this way. I'm starting to kind of take a look at how you're lining up your body, because posture is everything. How you line up your body when you sit, when you stand, when you run, when you lift, when you cycle, whatever you do, that will either elicit your body to use your muscles correctly and load your body correctly, or develop compensation strategies and load your orthopedic, like musculoskeletal system inefficiently. Got it.
Emily, I had mentioned earlier that you just courageously, as a public figure, share a lot of your fitness journey with everyone, and just wanted to ask you, what message around fit motherhood do you try to share with your followers?
Yes, I just really love showing that there is a difference in every single stage. I have so many friends and moms that, will ask questions about, what is my life going to be like when I have a baby, right? Or am I still going to be able to work out, or all of that sort of stuff. And I just really encourage them to enjoy the process, enjoy the moment. And, some of my workouts, again, I'm by myself and I'm getting a great sweat session in. And in other moments, I have all three kids, hanging on top of me, and we're doing a workout together and making it fun. So I just think that, having that self-love and self-care, every single stage I've been in, I work out in a sports bra. So, that is with a huge basketball belly. That is postpartum, 3 weeks afterwards. And I've got saggy skin and all kinds of other great things going on. And then that's with, 6-pack abs afterwards. And I just think every single one of those stages are so important. And so valuable. And it's just great to see how we change as women and as we work out and whatever our goals are, and just to really love on every single stage, because they're all fun, and they all kind of tell us a little bit about ourselves at each stage.
And I guess just nearing the end, I would love to just wrap it up with one final question, which is, what is one message that you'd like the audience to take away about postpartum fitness?
I think for me personally, there is no prescription for pregnancy, and that goes full circle. So how you're feeling during pregnancy and after is all going to be based individually. So there is not any sort of answer or timeline that we can give you that is going to be one size fits all. So I think just finding a doctor that you can communicate with and trust, and then having those tune-ups afterwards, and then listening to your body, are going to be 3 really key elements that will help you.
Yeah. And bringing off of that, I mean, like I said before, I think every woman should have a postpartum women's health physical therapy assessment. And I don't know if you're going to have links anywhere in this, but I can give you a link on where you can put in your zip code and find a women's health physical therapist near you, because some people don't even know where to find them. And then same thing that Emily said is that every woman deserves to feel as good as she wants to feel, and everybody's body is different. We need to stop the comparing of, oh, well, she can do that and I can't do this, and she looks like that and I look like this. Like, every single body is different. And as somebody who puts her hands on postpartum bellies all day, every day, just the feeling of the tissue is different in every single woman as well. So you deserve to feel as good as you want to feel in your body, and you deserve to get the kind of care and support and guidance from professionals in order to feel that way.
Great. Well, thank you both for your time. This was a very conversation, and also just provided a lot of motivation for women to just go get back into movement. So thank you.
Yeah, thank you. It was so fun.
Thank you. Yeah.